Hi, my name is Ashween Kaur and my student ID is 165585225. Before starting the video, my friend will take 360-degree round of the room. So now I'm ready to do her complete physical head to toe assessment. Hi.
Hi.
How are you?
I'm good.
Okay, may I know your name?
Yes, my name is Kaur.
Okay, I'm your nurse today. So according to doctor's order, I'm going to do your complete physical head to toe assessment.
Okay.
Okay, so I'm doing this assessment for your further interventions and your diagnosis.
Okay.
So are you ready?
Yeah.
Okay. Before starting the assessment, I'm going to do my hand hygiene. Put on the gloves. And maintaining the privacy. May I check your ID band?
Yes.
Your date of birth?
16 February 1997.
Name?
Kaur.
Okay. So I'm going to start her head to toe assessment. I'm going to begin with pain. So do you feel any pain right now?
Yes, I have pain.
Okay. Where?
In my head.
Okay. On which side?
On right side.
Okay. Could you tell me what kind of pain is it? Is it mild, moderate or severe?
It's mild.
Okay. How long you have been this pain?
I think last 3 to 4 hours.
Okay. So what's pain is it? Like, is it stable pain or radiating pain?
It's stable.
Okay. Is it affect your activities of daily living?
Yes.
Okay. So if I give you pain rating scale, what rate would you like to give from 0 to 10?
I'll give 3.
Okay, 3. So my patient, she is suffering from head pain on her right side, and she have been this pain from last 3 to 4 hours, and it's non-radiating pain, and she gave 3 points on pain rating scale. So I did this assessment with the help of PQRSTU method, and moving forward, I'm going to do her neurological assessment. For that, I will check her conscious level first, which include time, place, and person. So what's your name?
Kaur.
What's time right now?
It's 12.
Okay, so at what place you are?
At my friend's home.
Okay, who brings you here?
I came by my own.
Okay, so she is fully oriented to time, place and person. Now I'm going to check her cranial nerves, that is 3, 4, 6 and 7, and the name of the nerves are oculomotor, trochlear, abducent and facial nerve. So firstly, I will check her first 3 nerves together and facial nerve at the end. So close your eyes, open your eyes. Okay. So now you have to focus on tip of the pencil, and whenever I rotate the pencil, you just need to rotate your eyes, but don't rotate your head. Okay? Don't rotate your head. Okay. So now I'm going to check the concentration. So could you please put your hand on the left side of your eye? And just tell me what number is it. Just follow my tips of the hand.
3, 2, 3.
On your right side.
2, 3.
Okay. So now I'm going to check her parla. For that, I need a light. Look straight at the wall. Okay, so her pupils that are directed to light. Now I'm going to check the accommodation. So for accommodation, you have to look at the tip of the pencil, and whenever I tell you, you just need to look straight on the wall. Look at the pencil, straight on the wall, pencil, straight on the wall. And distance should be 30 to 40 centimeters. Now moving forward, I'm going to check her facial nerves. So could you please uplift your eyebrows? Close your eyes, open your eyes, close it tightly. Open your eyes, show me your teeth, show it with smile, makeup off. Perfect. So all her nerves that are intact and normal. So there is no abnormalities present, and she is fully conscious and oriented to time, place and person. So moving forward, I'm going to check her respiratory assessment. For that, take a deep breath, hold, relax, and she is breathing normally, and there is no her lungs are fully intact. And now I will ask her some questions. So could you please tell me, like, when you breathe, do you feel any difficulty?
No.
So okay, so she don't feel any difficulty and it's non-labored breathing. Now I will check her like lung sounds. For that there are 5 regions that are present anteriorly and there are 8 regions that are present posteriorly. So now I'm going to begin with the anterior region. For that, I'm going to start with the apex of the lung. Take a deep breath. Take a deep breath. Second intercostal space of the lung. Take a deep breath. Fourth intercostal space of the lung. Take a deep breath. Sixth intercostal space of the lung. Mid-axillary line. Take a deep breath. Okay, posteriorly. Starting with the apex of the lung. Take a deep breath. Between the shoulder bones. Okay. So I assess her lung sounds and like her lung sound, for lung sound, like there is no abnormal sound is present, like murmur sounds, stutter sounds, and all her the lung sound is normal. And her diameter I check anterior and posteriorly, that is 1:2. So moving forward, I'm going to assess her heart assessment, do her heart assessment. For that, do you feel any anxiety?
No.
Okay, perfect. So now I'm going to assess her heart sounds. For heart sounds, there is aortic sound that is present at the second intercostal space of the heart. Pulmonic sound at the second intercostal space at the left side of the heart. Up sound at third intercostal space at the left side of the heart. Tricuspid at the fourth intercostal space at the left side of the heart. Mitral at the fifth intercostal space at the left side of the heart, and their apical pulse is present that I will assess for 1 minute. Okay, and her apical pulse, that is 82 and normally. Now moving forward, I'm going to do her abdominal assessment. So for abdominal assessment, could you please lie down on the bed? So firstly, I will ask you some few questions like, oh, what is the last time when you wore?
In the morning.
Okay, when you pass your shoe?
In the morning too.
Okay, perfect. So now I'm going to do the inspection, and for inspection I'm going to check her abdominal girdle first from the posteriorly. Side by. Okay, so her abdomen that is flat. Now I'm going to do the auscultation. For auscultation, I'm going to divide her stomach into the 4 quadrants. It is left, right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant, okay. So for that, the vowel sounds that are present is 3 to 30 vowel sounds. And now I'm going to do the palpation. For palpation, I will do the same process like auscultation, dividing the stomach into the 4 quadrants, and I will palpate like superficially, not very deep. So and palpation, like there is no lesions or mass formation is present. So could you please back down the chair? Now I'm going to assess her extremities. For extremities, could you please uplift your arms? I will check like there is no bruises or lesions are present. And the skin temperature, that is warm normal. Now I will assess her radical pulse bilateral for 1 minute. Okay, her radical pulse, that is same as apical pulse, that is 82 plus 2 bilateral. Now I will check her nail capillary reaction test for 3 seconds. Okay, now I will assess her lower extremities. Could you please extend your legs? I will check like is there any bruises or lesions are present that are normal, and the warm temperature, skin turgor is normal. Now I will check her dorsal pedis. Now I will check her posterior tibia for 1 minute. That is same 82 bilaterally. Now I did her complete physical head to toe assessment, and after assessing I will do the documentation and hand it to the doctor for her further treatment and interventions according to her diagnosis. And after the ending of the video, my friend will take again 360-degree round of the room. So this is the end of my video. Thank you.